Thank you very much. Thank you for this very, very kind introduction. And I would like to say what was said in the introduction is right. My passion is to do whatever we can do to improve the quality of diabetes care for people living with diabetes. And it totally doesn't matter where they are. And to make a long story short, if we really want to improve fast and very effectively the health of people living with diabetes, what is the first step? We should motivate them to avoid carbs or avoid fried carbs. If we cut this down, we gain an enormous amount of health. The second thing is we should motivate them to be physical active because it lowers glucose, it burns down glucose in the muscle cell, and this will improve health. And the third thing is, what is a fast gain of health? We should motivate the people, especially in low and very low income countries, to get vaccinated. Because we know today a vaccination for people living with diabetes immensely and immediately improves the health outcome. And it's a big gap for us as healthcare professionals because we don't recognize, we are not used to it. And this is something we should change. My conflict of interest, I'm working with a lot of partners, and you find industry there, you find a lot of startups there, you find also political organizations, NGOs and funding organizations on there. And as I said at the beginning, the passion I have is doing whatever we can do to improve the quality of diabetes care. And you will find several QR codes on my slides. Many of them go to my WhatsApp channel, and this is a channel where I'm reporting about the activities doing for people living with diabetes worldwide as president of the International Diabetes Federation. A clear statement from the IDF is we know that we know that people living with diabetes are at significantly higher risk of morbidity and mortality depending on the infection, depending where they are. And this is should be become a determinant of driving our work, and at the end a determinant of improving the outcome for people living with diabetes. So as I said, there is a high prevalence of diabetes in India. 240 million people living with diabetes in India. The number is probably a bit too high based on the diagnosis with the oral glucose tolerance test. The number is probably a bit low based on the diagnosis with A1C. Should we fight about the right number? We know there are far too many people living with diabetes, and we are talking about glucose. We are not often enough talking about a 25 years pathophysiology before hyperglycemia, but at the end leading to hyperglycemia. And this 25 years pathophysiology before changes the expression of certain receptors. It develops insulin resistance. And these pathomechanisms make people living with diabetes risk, insulin resistance, or diabetes more vulnerable to infectious diseases, which we can prevent by vaccination. So very high rate of diabetes here in India. And if you look at this rate, how many family households have relatives with diabetes in India, it's the highest worldwide. Even if we go to Saudi Arabia, where we have today the highest prevalence of diabetes, even higher than India, we don't see this family history or family relation to people living with diabetes as in India here. And there are several mechanisms, and they are evidence-based, how the pure presence of insulin resistance and hyperglycemia makes you more vulnerable to infectious diseases. And one of the big examples is COVID. Yeah? You know, the AT2 receptor in people with insulin resistance was 3 to 4 times higher expressed in people having insulin resistance. And this was the big entry door for the virus, and this was a translation for people living with diabetes and insulin resistance having a higher risk of morbidity and mortality during COVID. Before the vaccination, I would say 87% of the people who went to ICU due to COVID and had type 2 diabetes died. If they did not have diabetes, it was less than 30% mortality. So a clear hint, not only a hint, a clear evidence for people living with diabetes having up to fourfold higher risk of contracting infectious diseases. And this is not only for one infection, it's relevant for multiple kinds of infection. And the pathomechanism for this is the presence of insulin resistance. And this is more relevant than the presence of hyperglycemia. And this makes it so difficult. If we say we wait until the people have persistent hyperglycemia and then we think about infectious diseases, it's too late. It's already the presence of early insulin resistance which increases the risk of contracting diabetes, contracting infections as someone having diabetes. I mentioned SARS or COVID, and you see here a threefold increase if you had diabetes to get COVID disease, and an up to fourfold increase to die because of COVID due to diabetes. And again, International Diabetes Federation is very clear, because if we are in Europe and would ask our colleagues whether they agree on what I just have said, they would say yes. Oh, we understand that people living with diabetes have a higher risk in getting infections and they should get vaccinated. And then we ask them how often you talk with the patient about, or how often you do it, it drops from more than 90% acceptance that vaccination is important to less than 8% that they do it. There's a very, very big gap where we, on the cognitive level, understand we should do it, but we are not actionable in it. We are not doing it. And this is actually very sad, because it would save life of people living with diabetes immediately. So greater awareness on the healthcare professional side is needed for vaccinations. We have to accept vaccinating people living with diabetes will improve their outcome and immediately also improve quality of life for them. And we have to improve our own understanding. We have to educate ourselves. You know that I often like to say prevention, prevention, prevention. In this case, we have to say education, education, education to leverage our ability to vaccinate our people living with diabetes. And why is it relevant? If we are not talking about diabetes, if we get older, we are getting more and more immunocompromised. That means our ability to fight against infection is going down and down and down. If we then have also diabetes with it, so aging and diabetes, we have double, or we could actually say triple hits to get immunocompromised by influencing T cells, by influencing other immune cells. So the response to an infection is compromised, and we would immediately benefit from a vaccination. And one of the infections is zoster. And normally I ask how many people are vaccinated against herpes zoster. And if we are in the European environment, no one raises their hand. And this is something we should and we can change. If we are looking again to people living with diabetes, we see that getting zoster as someone with diabetes significantly increase the complication, especially related to zoster-related pain for people living with diabetes. And you see here an up to 9-fold increased risk of having the complication related to zoster compared to someone who is not having diabetes. Looking into the vulnerability of infections, you see here people without type 2 diabetes and with diabetes, 2.6 to 9.8. So a 3 to 4-fold increased risk of getting zoster as someone having diabetes compared to someone not having diabetes. And this is actually higher than getting cardiovascular disease. So there is a big burden on mortality, or it's a big burden on morbidity in this moment, not mortality in the moment, big burden on morbidity due to having diabetes. And if you would say, like for cardiovascular disease, it's difficult to diagnose, it's difficult to treat for people who may not be able to pay for the treatment. A vaccination shot, one shot or two shots, it's easy to apply, it's cheap, and it immediately improves the outcome for people living with diabetes. Zoster-related pain, I mentioned this, is much higher in people having diabetes and zoster than compared to people without diabetes and having zoster. So it's 87% higher in people having diabetes. And I'm not sure that any one of you has experienced this. This can be extremely painful. And again, having a vaccination shot immediately would improve the situation. And as less diabetes you have, as less risk you have, as higher the diabetes risk is, as higher is also the post-neuralgic pain after zoster. And again, giving a vaccination would directly prevent of having these complications. How to do it? It's a double shot. It's a vaccine available. It's FDA approved. In the past, there were two vaccines. One was withdrawn after the vaccine here came because the efficacy is more than 90%, and the other one was taken off the market because it was less than 60% efficacy about years ago. So there's one vaccine available, and it's a double shot for people or for the vaccination. And it gives effective, lasting, sustainable immunization as a zoster vaccine here. In people with diabetes, high efficacy, 90%, and also the other chronic conditions is a high efficacy. And this is unique if you are talking about vaccination. It's higher than we ever had it for COVID and many other diseases. So it's cool to have this for our people living with diabetes. So the Shingrix I mentioned here is effective more than 90%, as it is shown here. And look at the age group. It's in all the different age groups the same efficacy. So what would be the right times to start? If you remember the graph I showed you, if you get older, we get more immunocompromised. And there is, so let's say, between 40 to 63 years is the curve going down with the immunocompromisation. If you then have diabetes, it's going faster and the curve is steeper. So 50 years would be a very good cutoff for getting a vaccination for someone who has diabetes. This is a recommendation we very clearly, very strongly have in Germany as well, have in whole Europe as well. And still there are so many colleagues not doing it. I mentioned the 8%. And that's why we highlight this here also as the International Diabetes Federation. It's important to change, to flip our mind into action to do the vaccination for people with diabetes. The cool thing is, if you vaccinate and they get zoster, there are no pains related to it. So you prevent zoster-related pain immediately. So now we all know there's a big stuff going on in the United States. And I looked today in the morning onto this website. And luckily, this organization still exists. Because the new Minister of Health in the United States has clearly said he wants to cut down and he wants to close the CDC. But this is a global relevant organization in terms of driving health promotion and health-related strategies worldwide. And I'm very nervous that in the upcoming weeks we will lose this organization. And if you today look into this organization and look to herpes zoster, what they are recommending, they are making a statement to two vaccines, and one is Shingrix, the other one is Zostavax. And you see here the reason why Zostavax is taken off the market, because the efficacy was around 60%. The efficacy in preventing the infection was lower. So, and the Shingrix is the one with higher than 90% effective and with high efficacy for people living with diabetes. But you could say, I don't care what the CDC is saying, what they doing in Europe. What is the current guideline of Diabetes India saying? Yeah? And here's a clear statement, recommendation of recombinant zoster vaccine in patients with immune-compromised conditions. And that means being older than 50 years is already enough. Having diabetes is a second hit. So we should translate this knowledge, which is very easy to digest, into action. So if you have a patient who is 50, if you have a patient who has diabetes, think about the vaccination. And we are talking about zoster. There are many other vaccinations which could be the same as relevant for people living with diabetes. Coming to the vaccine again, being 50, having diabetes means enough immunocompromisation to that it's becoming relevant for a vaccination. Beside pain, and this is something, if you vaccinate, you know it, the people report about pain for a few days. There are nearly no relevant side effects of the vaccination, which is good for our patient. How to do it? You give a single shot, and within 2 months, you give the second shot. If there are reasons to delay this, you can wait up to 6 months, but as faster you have it together, as better it's for the effect for the patient. And if you are looking again, recommendations of Diabetes India, what they are saying, here down there is the shingles herpes zoster vaccine for people above 50 years of age and having diabetes. You should not only think, you should action a vaccination for these patients. Coming back to the International Diabetes Federation, the driver who should be enough energetic to change our behavior was COVID. Yeah, we have run into the pandemic and we have seen that our patients living with diabetes has contracted much higher COVID risk than anyone else. They much more commonly died due to COVID because of diabetes. And I must say, in many cases, it was our fault because we accepted hyperglycemia, we accepted insulin resistance, and this was a door opener for morbidity and, in this case, also mortality for people living with diabetes due to COVID. And in the atlas, you find all the information put together how this was globally relevant for people living with diabetes. So as International Diabetes Federation, you should vaccinate people against various infectious diseases, including zoster. And this is not only we should think about, we should action and motivate our governments to prioritize and enable a framework where this vaccination is available and accessible for people living with diabetes and other chronic conditions to immediately improve their health. I'm inviting you to discuss this further at the next Global or World Diabetes Congress in Bangkok. It would be totally cool to see all of you there again and discuss latest developments in diabetes care with us. If you are very active, you have another, let's say, 10 to 12 hours left to submit the late-breaking abstract, because today at midnight there is a deadline for the late-breaking abstracts. We have nearly 2,000 abstracts already for the Congress. There was a very high acceptance rate, so there will be a good discussion about late developments in diabetes care, including vaccination for herpes zoster. There are a lot of phases of people living with diabetes, and a vaccine shot can enable to put a smile on the quality of life for people living with diabetes above the age of 50 years. Let's do it. Let's do it together. Let's follow this QR code. This is the WhatsApp channel I mentioned, and it would be cool to find you there, being interested and keeping contact with me as president of the International Diabetes Federation. But there are also many other channels to be used, and the information is the same or very similar, and I would love to stay in contact with you. If you get everything what you have here today, keep this. People living with diabetes should get vaccinated. And let's work together with all our ideas, all our intention, all our passion and commitment for people living with diabetes, and help our patients that they get vaccinated away from shingles. Thank you very much for your attention.
Thank you.